Hi everyone, this is your Med021. The topic which we are going to discuss today is an ulcer. So, in this video, we will discuss about the definition and classification of ulcers. In our later videos, we will go deep into this topic. And let us start with the definition. What is an ulcer? Ulcer is the break in the continuity of an epithelium. So, why is the break in the continuity occurs? It occurs due to the death of molecules, that is molecular death. So due to the molecular death, the break in the epithelium occurs and it is known as ulcer. Let's look at the parts of an ulcer. So the first one is the margin here. So the margin will be between the surrounding tissue. It might be the skin and the edges. So in between the edge and skin, margin will be there. So on next one is the edges. So the edges will be in between the margin and floor. So the floor is the part which contains the granulation tissue or the pulse. So it is known as the floor. And below the floor, we can see the base. So we cannot directly see the base, but the base lies below the floor. So the base can be the bone or a muscle or whatever it can may be. But what we can see is the floor only. So here based on edges, the ulcers are divided into different types. So if the edges are sloping edges, it mean an healing ulcer. So if these edges are sloping edges, here sloping edges. So if the edges are punched out, it is a non-healing ulcer. So if the edges are undermined, we can see in the tuberculosis ulcer. So these are examples of non-healing ulcer. So sloping edges mean healing ulcer. So based on the type of edges, again the ulcers are classified. We will discuss them later in the upcoming video. The next topic which we are going to discuss is the classification of ulcers. So ulcers are classified three types. So the first one is based on clinical classification, and obviously the next one is pathological classification, and the final one is based on the duration. So let us discuss these three things: clinical classification, pathological classification, and then based on duration. First one is the clinical classification. So under clinical classification, the first thing which we are going to discuss is an spreading ulcer. So first one. So how the spreading ulcer will be? In spreading ulcer, we can see here the edges are irregular. Remember, the edges are irregular, and the floor contains the discharge. The floor contains the discharge. So we can see under the clinical classification, the first one is spreading ulcer. The borders are irregular and it contains the profuse discharge. And under the clinical classification, the next thing is an callus ulcer. So in callus ulcer, it doesn't show any sign of healing. So why it doesn't show any sign of healing? Because the callus bring prevents the healing. So it doesn't allow the body to form the granulation tissue, so it doesn't heal. And it is the second one. And the third one under the clinical classification is an healing ulcer. So if an ulcer is healing, the first point which we have to note is that healthy granulation tissue. So granulation mean it is healing. So this red color in the pic you can see it is an healthy granulation tissue, and it is found in an healing ulcer. So this is the third one. And under the clinical classification, the final one and fourth one is non-healing ulcer. So if an healing ulcer has an healthy granulation tissue And what does the non-healing ulcer have? It has the unhealthy granulation tissue. So, under the clinical classification, so there are four types. First one is the splitting ulcer, which has irregular edges, and the second one is the callus ulcer. It forms the callus. So, this callus prevents in the healing of ulcer. And the third one is an healing ulcer. So, healing ulcer mean you can see the healthy granulation tissue. And the fourth one is non-healing ulcer. So in non-healing ulcer, you will see the unhealthy granulation tissue. That so in the main difference between the non-healing ulcer and the callus ulcer is in callus ulcer the healing is prevented by the callus. But when in non-healing ulcer, there might be any underlying cause like diabetes and infection and some other causes will be there. Now let us look at this picture. Here you can see, right? So in this picture, this ulcer has sloping edges. So these sloping edges are found in the healing ulcer. So and here remaining these punched out edges, these undermined edges, and raised and beaded edges are found in the non-healing ulcer. So in trophic ulcers, you can see the punched out edge, and undermined edge are seen in the tuberculosis ulcer. So in tuberculosis ulcer, the edges are undermined, and the edges are raised and beaded in rodent ulcer. So these TB ulcer, rodent ulcer, and trophic ulcers, these three ulcers come under the non-healing ulcer. So on these non-healing ulcers have different type of edges like punctured, undermined, and raised and beaded. So and here now we completed the clinical classification. Now let us see the classification based on duration. So simply based on duration, it is whether acute ulcer or chronic ulcer. So acute ulcer mean it takes less than 2 weeks to heal. What does chronic ulcer mean? Chronic ulcer takes simply more than 2 weeks. That's it, simple. Now let us discuss the final classification, pathological classification. So in pathological classification, we can see the specific ulcer, non-specific ulcer, and malignant ulcers. So the specific ulcers mean we can directly point out the underlying organism. The tuberculosis is caused by the Mycobacterium tuberculosis, and syphilic ulcer is caused by the Treponema palladium. So in this manner, the specific ulcers are caused by specific organism. And when it comes to the non-specific ulcers, we cannot say like, so the trauma might be an mechanical, physical, or chemical. It can be anything. So the atrial ulcer, the trophic ulcers. So all these comes under the non-specific ulcers. And moreover, the diabetic ulcer is on non-specific ulcer. So the next type is the malignant ulcers. So the examples of malignant ulcers are squamous cell carcinoma and the basal cell carcinoma. So now let us recap everything what we discussed in this video. So first definition of ulcer. What is an ulcer? So ulcer is nothing but the break in the continuity of an epithelium due to the molecular death. So like I said, it is an classified based on three things. Number one is clinical classification. Number two based on duration. Number three is pathological classification. So under clinical classification, there occurs four type of ulcers: spreading ulcer, callus ulcer, healing ulcer, non-healing ulcer. Healing ulcer, the granulation tissue is healthy. Non-healing ulcer, the granulation tissue is not healthy. Unhealthy granulation tissue. In unspreading ulcer, the edges are irregular and it contains the discharge. profuse pleural discharge, where they are punched out edges, undermined edges, and raised and beaded and rolled out in the carcinomas ulcer. So based on duration, whether it's acute or chronic, acute mean less than 2 weeks, chronic mean greater than 2 weeks, it takes time to heal. So the based on the time it takes to heal, we name them, we classified them into acute and chronic. And pathological classification here only three: specific, non-specific, and malignant. Specific mean based occurs by the specific organism. For example, in tuberculosis by the Mycobacterium tuberculosis, and encephalitis by the Treponema palladium. So in non-specific also we cannot say the underlying cause. It may be traumatic. The trauma may be mechanical, physical, and chemical. And arterial ulcer, trophic ulcer, and diabetic ulcer. All of these comes under the non-specific ulcers, right? So this is an overview. Thanks for watching the video. And the next topic which we are going to discuss is an venous ulcer and then trophic ulcer. Follow Med021 for more videos and don't forget to subscribe.